country poised to have the largest population, with nearly 24.8 crore households, out of which 70% of it is in rural India, with a median level human development index, with our key health indicators looking up and showing positive progress, be it with respect to the maternal mortality rate, infant mortality and child mortality rate, however scoring poorly on the sex ratios, a time has come nearly after 25 years of reforms for us to take stock as to where this largest democracy is positioned with respect to the healthcare sector. With India going to celebrate the Amrit Mahotsav in 2022, 75 years of independence, the Symhealth conference has been perfectly timed as an interdisciplinary concept and indeed a step in the right direction. A demographic dividend to our advantage, a very youthful population, having a median age of 27.6 years, it is imperative for us to understand whether the productivity of this very youthful economy is moving forward and will contribute to higher GDP growth. The questions that are posed in track 1 of this conference on healthcare, economics and financing are sixfold. To understand the economics and financing of healthcare, global and national perspectives, the economics and financial models with respect to both the consumers and producers in the healthcare sector, the role to be played by the regulator with respect to the drug pricing policy, affordable healthcare services so that we ensure that the principles of inclusion and equity are addressed, from the Millennium Development Goals to the Sustainable Development Goals, the road taken with respect to MDGs from 2000 to 2015 and with respect to the SDGs from 2015 to 2030, the role of the government through multiple schemes and initiatives at the national, central or state level, the role of civil society, which of course cannot be ignored. All these above 6 concerns will be addressed in this track for a healthcare sector which has been growing at nearly 15% compounded annual growth rate and is likely to touch $280 billion by 2020. I am sure this track will indeed be extremely enriching and will address the relevant concerns.